Hi everyone, I'm drthejaswinipeddakotla, consultant newborn and children's specialist from pebblespediatrics. For the past few weeks, we have been seeing quite a few number of cases of sore throat and scarlet fever caused by streptococcus, and the parents are quite concerned about it. So today, let's see what is this infection, what are the symptoms, what are the management and preventive strategies. So the streptococcal infection, as the name suggests, is caused by a bacteria called streptococcus, which causes many illnesses including the streptococcal sore throat, that is pharyngitis, scarlet fever, impetigo, and many other complications. So how does this infection spread? It easily spreads from one person to another person, from an infected person when he sneezes or coughs, or from direct contact when you are in close proximity with the infected person also, it can easily spread. That is why it is seen in outbreaks, and especially during colder months. But like I said, in the past few weeks we have been seeing quite a few number of cases in kids especially, along with adults also. So what are the symptoms we need to watch out for? The streptococcal infection can cause a high fever, which is more than 101, 102. The child is very dull and lethargic. There might be sore throat, throat pain, which makes the kid difficult to swallow and they keep refusing the food. There might be something called swollen lymph nodes sometimes. So, and apart from these, the scarlet fever especially causes something called a strawberry tongue, which is a red tongue, and also a rash, which starts initially on the neck and chest and it spreads throughout the body. Apart from this, the child is very dull, lethargic, like I said, refuses food. Sometimes there might be accompanying tummy pain and vomitings also. It is essential to seek medical attention in case you see any of these symptoms in your kids, because sometimes it can lead to few complications by this bacteria, which can involve heart, lungs, kidneys, sinusitis, pneumonia-like symptoms. So when you notice any of these symptoms, please consult your pediatrician as soon as possible. To diagnose this condition, your doctor will thoroughly check the child to look for fever, throat, any lymph nodes, how is the tongue, is there any rash on the body, and sometimes few laboratory tests might be needed, including a throat swab and also blood tests. If at all it is a streptococcal infection, then prompt treatment with antibiotics will be started by your doctor, and the course and the duration of the antibiotics need to be completed as prescribed. How do we prevent this disease from spreading? As we have seen, it easily spreads through respiratory droplets. So maintaining a cough etiquette, hand hygiene, wearing a mask, and keeping the kid at home when the symptoms are present is essential to prevent the spread. So as we have seen, if these symptoms are present, please do consult your pediatrician immediately. And fortunately, though the symptoms can sometimes be severe, there are antibiotics which work very well for this kind of infection. Thank you.